A big vacation, your wedding day, a final exam. What if you could just pause your period for it? I mean, that's the whole idea behind period delay pills, right? But is that kind of control actually worth the risk? Let's get into it.
So here it is, the million-dollar question. Are these pills a safe, convenient fix, or are we all overlooking a really serious danger? Well, the answer isn't a simple yes or no, and that's exactly why we need to talk about it.
Okay, so first things first, why would you even want to do this? We've all been there. You've got this huge, important life event coming up. You check your calendar, and yep, your period is scheduled to show up at the worst possible time.
Exactly. We're talking about that once-in-a-lifetime vacation, an exam that could decide your future or even your own wedding day. In moments like these, the idea of just hitting a pause button on your cycle feels like an absolute lifesaver. But how on earth does that even work?
All right, let's pull back the curtain and get into the science of it all. Because this isn't magic, This is serious medicine that directly interacts with your body's natural hormonal cycle. And understanding that is the first step to understanding the risks.
The key ingredient here is a synthetic hormone called progestin. Now, your body naturally makes a hormone called progesterone, and its job is basically to maintain the uterine lining. Progestin is a man-made version that mimics the real thing, essentially tricking your body into thinking, nope, not time to start a period just yet. So it's really a two-step move. First, by taking the pill, you're artificially keeping those hormone levels high. And second, that sends a clear signal to your body to just hold off on shedding the uterine lining. This whole process effectively postpones your period until you stop taking the pill. Simple as that. And this is a really important point. When they're used occasionally, for a specific big event. And here's the crucial part. Under a doctor's supervision, these pills are generally considered to be safe. That's their intended medical use. But you really have to hear those key words, occasional and doctor supervised. But that word generally is doing some pretty heavy lifting in that sentence, because the second we step outside of that perfect doctor-approved scenario, the whole conversation changes. It stops being about convenience and starts being about risk. And those risks fall into two very, very different categories.
On one hand, you have the common side effects, stuff like nausea, bloating, mood swings, maybe some spotting. Super annoying, for sure, but probably not going to land you in the hospital. But then, on the other hand, you've got the serious risks. And now we're talking about things like blood clots, which can lead to a stroke or a pulmonary embolism. Suddenly, the stakes are incredibly high.
And look, this isn't just a theoretical what-if scenario. A recent tragic case involving an 18-year-old student really brought these dangers into the spotlight. It's a truly sobering reminder that using this kind of medication without proper medical advice can have absolutely devastating consequences.
And for some people, the risk is just too high, plain and simple. If you have a personal or family history of things like blood clots or stroke, or you have liver disease, certain cancers, or uncontrolled high blood pressure, these pills are just not for you. This is a non-negotiable safety list, and only a doctor can really help you navigate it.
This brings us to a massive point of confusion, and frankly, where a lot of the danger comes from, the gap between the myth surrounding these pills and the actual medical reality.
The myth is that you can just pop one of these like it's a Tylenol, a simple, harmless little fix. But the reality is that this is a powerful hormonal medication. It fundamentally changes your body's chemistry and absolutely requires a doctor's prescription and supervision. Treating it any other way is, honestly, a massive gamble.
Let me tell you a real-life story that shows you exactly what I mean. A friend of mine was super stressed about her exams and decided to self-prescribe these pills to manage her period dates. Just a few days in, she started feeling dizzy and noticed some spotting. Thankfully, she went to a doctor who found she had early signs of blood clotting. Her story could have ended very, very differently.
So with all of this information on the table, how do you make a safe choice for yourself? Well, it really all comes down to being informed and always putting your health first.
I think the easiest way to look at it is like a simple green light, red light system. The green light, the safe path, is for a one-off major event with short-term supervised use, and only after you've had a full health screening from a doctor. The red light, that's the danger zone. That's any kind of self-prescription, any uncontrolled use, or ignoring your medical history.
So the crucial point, the one thing you need to take away from all of this, is this. Always, without any exception, consult a healthcare provider before you even consider taking these pills. They are the only ones who can really determine if it's a safe option for your body.
And that really brings us to our final thought. For those of you who have considered or used these pills, under a doctor's care, of course,
What was your experience? Was it a clear benefit for a huge moment in your life, or did you run into some of those side effects? Thinking about these real-world outcomes is so key to helping all of us make smarter, more informed decisions about our own health.